In an attempt to tug at the heartstrings of the Kenyan public, Kenyan medical practitioners, pharmacists and dentists union officials took to social media today. They are sharing posters of their personal stories. They are tagged with the hashtag #ImplementCBA and hashtag CBA for Kenyans. The posters also indicate the date the union officials could go to jail for what they are terming advancing the right to the highest attainable standard of health.
So there you have it, is the first post from the Union Secretary General Dr. Omalu. He says his father died in a public hospital when he was just 11 years old. If his father had access to the best healthcare available in Kenya, he may have been alive today to see his son champion the right to quality healthcare for Kenyans of all backgrounds.
The next one is from Dr. Mochonda Chibanzi. He's the Deputy Secretary General. He says he grew up in one of the poorest counties in Kenya, and when he graduated, he chose to return to serve the community that raised him, a community that struggles to choose between putting food on the table and buying medicine when sick.
And next was the chairman of the union, Dr. Oroko, who says he walked barefoot to school because his family couldn't afford to buy him shoes. As a child, he was afflicted by jiggers and became the village expert on jigger removal. He became a doctor to provide quality healthcare to Kenyans of all backgrounds.
The Vice Chairman of KMPDU, Dr. Laroche, also shared his story as a dental surgeon. Improvisation of equipment to allow for service delivery in the public health sector is the norm, he says. The dental community has lost lives in the line of duty due to the risks of doing so. Unfortunately, when they're injured during the course of their work, they cannot access quality healthcare. And
lastly was Dr. Korir. She's the treasurer of the union. She knew she could no longer be silent about the state of health services in public hospitals the first time she lost a patient because basic equipment to manage medical emergencies wasn't available in the A&E department. That's Accident and Emergency Department. Now, this social media appeal shows just how much the doctors are counting on the public support to help influence the implementation of the 2013 collective bargaining agreement. The doctors' union officials were given until Thursday this week to call off the strike by the Employment and Labor Relations Court, failure to which could mean jail time. After 50 days of a paralyzing strike, let's see if the next 4 days will be enough to see the impasse come to an end.
And it will be a very important 4 days, isn't it? Because there's a possibility within that, when that time lapses, they might be going to jail.
Right.
And I think the social media updates and the stories, the personal stories of the officials helps to underscore why it is important they're fighting for that CBA.
Right. Give them some sense of humanity.
Exactly.